will proceed to Lauren Kirk, who has joined our team a couple of years ago in following someone who'd been for 6 years with our team as our first patient navigator. And it's a hard thing for me to imagine, and I'm sure for all of you in our patient community, how things worked before we had patient navigators there on the phone, available literally every day, and facilitating the entry of patients into the system, which is unfortunately much more complicated than we would like it to be, and requires many more elements for us to be able to make a proper assessment of patients coming in for treatment of one of the various cancers that we deal with. So with nothing more ado, we'll turn to Lauren Kirk, who is our patient navigator and central initial point of contact for all of our patients, family members, and supporters. Lauren, take it away.
Thanks, Dr. Kirkwood. I'm Lauren Kirk, and I'm the patient navigator for the Melanoma Center. Today, I'm going to talk about process of referrals. So we schedule with medical oncology and schedule with surgical oncology if needed. If they need surgery during seeing the medical oncologist, we'll coordinate the appointments for both of them the same day. Items I need to expedite the process are imaging on a CD, records, pathology, scans, office notes, labs, insurance info, and demographics. Insurance is like the top thing I need, because even if the patient is in Pennsylvania and they have an out-of-state insurance, that's where it gets tricky on getting these patients scheduled in a timely fashion. Patients that the providers I coordinate for are Dr. Kirkwood, Dr. Najjar, Dr. Devar, and Dr. Luke, and Dr. Sanave, and Dr. Burgess, although Dr. Burgess does our sarcoma patients. You can reach me at my email, clarkle@upmc.edu, or my address, UPMC Hillman Cancer Center, 5115 Center Avenue, 2nd floor, Pittsburgh, PA 15232. And my phone and fax are located here too.
So I think it's hard to underestimate the importance of our navigator in facilitating entry to the system, but it's an extremely complicated place. It's a one-stop number, one-stop email, and that number that Lauren gave you is open and something you can call when there are questions before a visit, after a visit when things are still hung up, and sort of as we all have provided our contact numbers at your initial visits in the center. Lauren is there to facilitate things in follow-up as well as in the initial entry to the system. The insurance and the other demographic stuff, which you don't have to do after the first time, and the management of any questions that may arise in regard to the treatment plans and the follow-up plans, which often are not self-apparent. Again, I see one question, although it's not popping up. So sorry, this is one for earlier for Darcy, so we'll come back to this perhaps. But I guess, Lauren, we're glad you're there. I know all of our patients are delighted that you're there, and thank you for your part in orchestrating the visits and all that is entailed for a patient to get into the system, which, as you pointed out, is fairly complex. Happily for patients, it means that when you have a visit where you need both a medical oncology and perhaps a surgical oncology or perhaps a thoracic surgical oncology expert, Lauren can set up these visits before you've even come in so that the visit entails 2 or 3 other evaluations to save you time. Many of our patients come from 4, 5, 6 hours away, and this facilitation of the visit, the multidisciplinary care, as we call it, is, I think, a crucial aspect of optimal medical care for any cancer, but in particular for melanoma, where it often involves multiple subspecialists and multiple elements of data for us to be appropriately able to adjudicate care.